My hope and belief is that you can have a good ending in any setting. Hospitals are a great place for treatment, but not for care. If mum is living with dementia, she is going to find hospital a really scary place.
My mum loved food, but this is diminished quite substantially.
People are not dying of starvation and dehydration, they're dying of their underlying illness. And that's what you've got to hold in mind. If she is not responding to treatment at home, you have got a difficult decision. If she's really close to the end of her life, there are other signs that you might notice. And are you ready to speak about those now? Hi Sue, I'm Dr. Ros Taylor. I'm a palliative care doctor. I know you've got some questions for me.
I have many, I'm afraid. I'm Sue, and I've been caring for my mother who's got dementia. She was diagnosed probably about 8 or 9 years ago, so she's done brilliantly. But we're now at a point at which we have full-time care at home. One of the things that worries me a lot is if there came a time when I couldn't care for my mum anymore. I have a family of my own and I'm very busy as well. And if anything happened to me, I'm not sure that we'd have the care in place to look after mum. What options would you be advising the family to take for mum? Would it be hospital? Would it be a hospice? Would it be a care home that had support for palliative care?
It's a really good question, because we don't really know what the future holds for anybody, and situations, context changes. So my hope and belief is that you can have a good ending in any setting. Hospice is a good place to end your days, but it's a really specialist place and probably only appropriate if mum's in her final days or has got some really difficult symptoms like pain or severe breathlessness that need supporting. But they're not long-term places of care. They're either to sort something out or for last days. I have seen some amazing endings in care homes, and it's all about, is there enough palliative care knowledge and input to support a good ending? So I wouldn't be too frightened, but you would have to research it and choose the best care home. Mm-hmm. And then there's hospital. Hospitals are a great place for treatment, but not for care. But I have also seen some good endings in hospital, but they're not peaceful places. It's about what you really want for your mum. Is there a way we can support you at home any further? But if not, I think it's care home or hospice.
And when you say care home and doing the research, how does one go about doing that? Is that something that I would just tap in on the internet, or would I talk to my GP about that? How would I know the right care home?
That's a really good question. I think it is about personal recommendation, looking locally, how near do you want to be to your mum? There are care homes that cater for different illnesses. Some have more palliative care. You can look at the website, you can look at their Care Quality Commission report, that CQC report. Yeah. But really, you've got to go and visit and get a feel, really get a feel of what an environment feels like, and maybe speak to some of the residents or some of the families visiting the residents.
So it is something that I should be not waiting until that moment in a way. I should be preparing myself and maybe going to look around at an earlier stage than when the crisis happens, if you like.
Yes, but care homes change. I think I would focus on how well you can care for mum at home. But if the time comes, then you really need to research the best place for her and find out a bit more about the local hospice as well, just in case.
Thank you.
And tell me a bit about your mum. How is she at home? Is she in bed all the time, or is she up and about?
She's in a wheelchair, so there's quite a lot of hoisting in and out of bed.
Right.
She speaks very little. She smiles a lot. And, I feel very sensitive about taking her somewhere else and putting her in a hospital. But I recognise that when things, when she's not well, where do I go? What do I do? What would you be advising for me for that?
Okay, now that's a difficult question, and everybody's an individual. My first question would be, what do you think your mum would want? Say she had an infection. The options are treating at home with oral antibiotics or going into hospital for intravenous. But if mum is living with dementia, which sounds though she is going to find hospital a really scary place.
Absolutely, and that's very important for me, that she feels comfortable and secure and settled. And I've always thought that when we don't really take her anywhere now, so the idea of taking her into a hospital with lots of people that she wouldn't recognise, because she definitely recognises people. So for me, I would be suggesting that for her, I would believe that she would want to have care at home, to have the hospital, if there was any way that they could provide those antibiotics or someone could provide those for her at home, so that we've got some support, but it's not necessarily in hospital.
Okay, so antibiotics are really valuable, and they can obviously buy a bit of extra time, and they can be given in many different ways. They can be given orally as a syrup if she's struggling to swallow. They can be given by injection at home, not necessarily through a drip. So it's all about whether it's the right thing to do, but it sounds as though she would be probably traumatised by going into hospital, and it's about finding ways of really providing maximum comfort at home,
yes,
which might be...
And also I think as a carer,
yeah,
that would be, it's quite traumatising for me too, if I'm honest, because visiting times are different. Her being in hospital means that we wouldn't be there in the same way. So there are other family members who also regularly visit her. So I'd feel that in the round, it would feel that you're guiding me, that it would be something that we could set up at home when she was feeling poorly.
And there are some really good community resources. There's district nurses. Many hospices have hospice at home teams now. I don't know if you've got a good GP, but I think it's about finding who can help you navigate the best care possible at home.
Dr. Ros, do you think there's any time when she might actually need to go into hospital? And how would I recognise that? And when would be that time? Because there will be a moment when antibiotics is just not the right thing, and she's very, very poorly. Is that the time?
Well, if she is not responding to treatment at home, you have got a difficult decision to think about. Is this the time when mum is close to the end of her life, that maybe she's dying? And actually, from what you've told me, Sue, I think she'd want to stay at home and be kept comfortable with the right amount of pain relief, keeping her temperature down, helping her symptoms. And I don't think hospital's got anything to offer in those situations. Now, if mum was earlier in her life, still with dementia, it might be appropriate to go into hospital, have a few days of intravenous antibiotics, get better and come home. So it's all about timing, her wishes, and how much she would be affected by a change of scene, new carers, which you've already described, she would find really difficult.
I suppose the one thing we haven't touched on is if there was an emergency and, suddenly she wasn't, I felt like she might not be breathing as well. This was not just a mild infection. Is it right that we should be calling for the emergency services to come, and then would they be making that decision with me about hospital? Is that a time when actually hospital is the only way, is the only answer?
I think rarely hospital's the only answer. But now paramedics, for instance, you've mentioned the ambulance service, many of them have much more training in end-of-life care and would also help to keep mum comfortable at home. If mum, for instance, was choking, something like that, something that could be easily reversed or helped by hospital, it might be worth a trip to A&E. But it might be a terminal event, and it depends how prepared you are for mum to have a peaceful ending at home.
What would happen, and this does worry me, if mum were to fall out of bed? Obviously, she's got the necessary, the occupational therapy team have been, so we've got all the necessary things that we need. But there can be accidents. She might fall out of her wheelchair. Sometimes she falls forward. And she actually was crying out in pain, and that she would seem that she may have broken something. What would you say to that? Because being at home and the paramedics come and they say, it looks to us there's a fracture. Is that not a time when actually I have less choice?
I think you're probably right, and sometimes it's important to know whether there is a fracture and whether mum is well enough to have that fracture operated on, because that's about reducing pain and comfort. Now, it is possible to look after somebody at home with a fracture as long as you've got good advice on pain relief, but often a fracture is a cause for an admission. But the other key thing is to try and get your mum back home as soon as possible.
Yes, understood. Mum's not at this stage yet, but I'm aware that towards the closing stages that she might get breathless. And is there a way that we could have oxygen tank at home? How is that something that I could help with? Would I have to find that she's in hospital and that I would just have to give over to them to deal with it?
It is possible to have oxygen at home. It's usually given by a machine called an oxygen concentrator, but it's actually quite rare to need oxygen at that stage of life. There are many other ways, gentle ways, that you could help the breathlessness. So simple things like a handheld fan, opening a window, teaching mum some breathing exercises which you could do with her. Aromatherapy oils could calm her down and help her breathing to slow down. And there are medicines. So oxygen's often actually a last resort and doesn't often help people particularly. It often dries the airways up. But if a doctor really thinks oxygen will help, then it's possible at home and it can be organised within a few hours.
That's amazing. But I like the idea of supporting her and trying to do it myself with her, because that sounds very sensible. Because as you say, it feels, because I always sort of think of people with things up their nose and, when I've seen it on the TV, but the idea of being able to perhaps support her, doing it with her, feels very lovely, actually.
And you're right. Things up your nose are very irritating, and it sounds though your mum will just pull it off.
Yes.
She'll be very good at telling us what she wants and doesn't want.
Absolutely. It'll come as no surprise. I've had many conversations with the GP about lots of things regarding my mum. One of the things that they've asked me recently is about whether or not we should resuscitate and CPR. And I just wanted to touch on that with you because I'm not sure what's best, and perhaps you could guide me on that.
Okay, it's a common topic and people often have seen resuscitation on television, on medical soap operas, and it looks like something that should happen to all of us, that we should all be resuscitated. But at the end of a long illness like your mum's, who's living with dementia, it rarely helps. It's rarely successful. It's pretty brutal. If you've seen people have chest compressions and electric shocks, it wouldn't really help her. And it's not something that we recommend at the end of a long illness. It just wouldn't be successful. But that doesn't mean that all other forms of care should stop. It's literally about what to do when her heart and her breathing stops, and she shouldn't be for resuscitation. And we need to complete some paperwork to make sure that if paramedics are called or if she dies at home, nobody attempts resuscitation.
Okay, so that's a form that I would sign as her power of attorney, or lasting power of attorney, or I may need to check her records because she may have already done it for herself.
Just to say on that note, it's actually a medical decision, Sue. So the doctor will sign the form, but having had the discussion either with your mum or with you as her lasting power of attorney.
Okay, that's helpful. Thank you. My mum loved food and had a great appetite, but this has diminished quite substantially over the last few weeks. And actually, we're really only drinking fortified soups with a struggle and milkshake type drinks to give her that boost.
Artificial ones or things you're making?
Things that artificial ones.
Okay.
So that can be a sort of Nesquik makeup with powder.
Yeah.
But she's not really chewing anymore. And I just wondered, should I be forcing the food situation? Should I be force feeding her? Is that okay? She's losing weight. I just sometimes feel that I might not be doing enough. Should I be doing more?
I think you're doing all the right things. I mean, we do recommend real food and real fluids rather than all of the artificial ones. But you've said mum loves food, and food is a symbol of love, isn't it? We all want to see people eat and drink, and it's really difficult to watch people eating and drinking less. So I think keeping up with what her favourite foods are, small, regular, soft meals, often, and not worrying too much about calories, really focusing on pleasure. But there might come a time when she really can't swallow at all. Now, how would you face that? That would worry you.
It would. And actually, I'm already feeling worried because she's not chewing, and at mealtime she's not really interested. So, there's no real schedule anymore. We're just, if she looks like she might be hungry, we'll give her something. But I would worry, man, if there came a point at which she wasn't eating anymore, not chewing and not taking food, what is the next stage for her? And again, would that be something that we'd have to get someone from the outside to bring something in to support her? Is that more tubes? How does that work for her?
I think it's again, Sue, about thinking where your mum is, what stage she's at in her illness. So reduced appetite, and particularly becoming unable to swallow, is a difficult stage and often a more terminal stage in an illness. Now, there are experts, speech and language therapists, who can help to advise on how to make swallowing easier and less risky. But if mum truly can't swallow, then that probably is close to the end of her life.
Yeah.
Now, some people ask about what about artificial feeding, intravenous feeding, tubes down your nose to feed. It sounds as though she would find all of that really difficult. It probably would prolong her life a bit, but it probably wouldn't give much pleasure. We need calories and fluid to survive, but we also know that the terminal phase of many illnesses is that appetite and swallowing diminishes. And people are not dying of starvation and dehydration, they're dying of their underlying illness. Yeah. And that's what you've got to hold in mind. But there are some very clever ways of even giving tiny amounts of calories and fluid to people and focusing on mouth care, keeping her lips and mouth moist and clean. There are ways of giving flavoured ice cubes or bubble machines that can give her a bit of pleasure. So I don't think tubes are the answer. Definitely not nasogastric tubes. They get blocked, they fall out, and again, they need hospital, which we want to avoid.
Yes, and I also think it's about dignity as well for her, that if, she was able to tell me, I think she would be saying, don't prolong my life in that way, that she would be much happier to think that she passed, as you say, from her underlying illnesses, and that we didn't shove things in because we wanted to prolong her life. Because I sometimes think as carers, we have to, there's a dividing line between what we want for our relatives and what the relative actually wants.
I think you're being mother-centred, which is great, rather than thinking about your own needs.
At the point at which she is no longer eating and it's been going on a little while, and I can see that she's fading physically, how would I know that she's not actually hungry and that she's suffering? Because I couldn't bear that.
I understand that, and that's a very common question. I think if you look back, you will have seen that her appetite has slowly gone down over the recent weeks and months. And now, in her final days, we don't believe that people are hungry. We don't even believe that they're thirsty, but she might be experiencing a dry mouth. So there's a way of keeping the mouth and the lips moist. And there may even be a little way of giving her a tiny bit of fluid through a syringe or off a teaspoon. Stop worrying that she's hungry and thirsty and just focus on comfort.
Yes.
Some people ask me about drips towards the end of life. And of course, they're possible. They're possible and very, very easy to put up in hospital, but they're uncomfortable. And often people are given too much fluid. It will hydrate them, but it might also cause their breathing to be more compromised. They get a rattly chest. They need to go to the loo more often, which can be very uncomfortable if you're bedbound. So we really don't recommend intravenous hydration when somebody's close to the end of life.
So when we talk about the breathing, someone has mentioned to me, and it sounds a bit grim, the death rattle. Is that something I should know about?
Yes. So as people are dying, they can't cough up the normal secretions that come to the back of our throat that we would just cough and we wouldn't notice. So often the breath bubbles through some of these secretions, the mucus, and it makes a noise. But it doesn't worry the person who's dying, but it does worry the people who are watching and listening. There are various ways to reduce it by turning a patient or moving their pillows. And there are medicines that can dry up the chest a little, but you need to hang on to the fact that it very rarely disturbs the person, the patient themselves. So, and it is a gruesome name, death rattle, but it is a real thing, and it's good that you've asked about it.
So Mum's been unwell for quite some time, and there are all those times when I just think, are we getting close? How will I recognise that we're at that point?
I think you'll notice quite a few changes, maybe week by week, that she's moving a little less, eating a little less, maybe sleeping more, engaging less with the family, speaking less responsive. And those are the signs that often change week by week. Now, if she's really close to the end of her life, there are other signs that you might notice. And are you ready to speak about those now?
I think so, because we're already at a stage where she's sleeping a lot. And, I've understood that, that's the next stage, and those sleeps are very deep. So I suppose I understand that we are getting that bit closer, and I understand that's one of the signs, but I think it'd be useful to know what other things I should be looking out for her.
Okay, well, the first thing I'm going to say is that doctors and nurses are very bad at predicting how long somebody's got to live. We're often way out, but there are signs that often the carer recognises before the healthcare team. So if Mum was really in her last days and hours, I think swallowing would have become very difficult. She might be sleeping 22 out of 24 hours. She might be struggling to breathe a little, but I don't think she'd be suffering too much because she'd be much less aware. The other thing that sometimes worries people is that people become a bit more delirious or confused. She might hallucinate a little. All of these symptoms can be helped really easily by an interested GP or a good palliative care nurse or district nurse. So there are many people who can help in the final days at home. But I think you'll know from changes in circulation, she'll be possibly barely drinking, she'll be quite still a lot of the time, she might look more pale as her circulation shuts down. I think you know her so well that you will be aware of these changes.
Dr. Ros, thank you so much for your time today. It's been really, really helpful. And I believe it will be really helpful for Mum too. So thank you.
Anytime, Sue.